medmj.com.
It's time for the Russ Belville Show's Cannabis Q&A with Dr. Mitch Earlywine. Dr. Earlywine is a professor of psychology at the State University of New York at Albany and a leading author and researcher on cannabinoids and health, who pins the Ask Dr. Mitch column for High Times magazine. Get your questions ready in our live chat or call in to 971-533-7111 now.
Welcome back, everybody. Half past on a Monday, and that means it's time to take your medicine. Dr. Mitch Earlywine is here for our Cannabis Q&A. How you doing, Dr. Mitch?
Woo! Better than last week.
I know. You had some dental work done last week?
I'm afraid I got to go back in the morning. I've got a new appreciation for chronic pain patients, I'll tell you that.
I'll bet you do, man. That's some of the worst pain. It's all that nerve pain, too, which, I mean, there's a question. Nerve pain, dental work, cannabis. What's the deal?
Well, in fact, I can tell you from my own tincture experience that you really, really need it because it just hurts like hell otherwise, and you can only take so much ibuprofen before your gut just wears out. So I really think the most humane thing to do, of course, it would be to have this available.
Right on. Well, folks, our phone number's up on the screen, 971-533-7111. If you're listening live and got a question for Dr. Mitch on cannabis science, culture, history, or health, we can probably answer it for you. But let's get to a few questions I've got built up from last week, and we'll also check our chat room online for their questions. The first one here, I just got done with the news, and in the news there was this new study out from LA Biomed saying that marijuana helps prevent death for brain trauma patients. Man, this is some really good news.
I mean, I'm to the point now where I feel like basically anybody playing a sport where their head might get injured should have THC handy. I mean, this is astounding data where basically they had folks come in and they either tested positive for THC or didn't after a trauma. We've had brain injury research on animals before to show that THC can really protect against some of the negative consequences of brain injury. But now we've got some really intriguing human data where essentially the folks who had THC in their system when they came in were literally a fourth as likely to die as those who didn't. And I mean, we're talking about the ultimate dependent variable here, mortality.
Yeah, and I would love to see a follow-up on this. Let's see if we can get the grant for Dr. Mitch to do this on former NFL players, because there's been a lot of look at them and their results of traumatic brain injury leading to aggression, suicidal tendencies, early death, dementia, Alzheimer's, and so forth, Parkinson's, all of that. It'd be great to get a look at former NFL players, because there's a large cohort of them, and quiz them on their marijuana use as they had played the game to see if that changed the outcome for them.
I mean, that would be completely delightful. When we start looking at both vascular and Alzheimer's-related dementia in these guys, sometimes as early as their 50s, which is just frightening. And I think that, you know, anything that can help protect them is bound to be helpful.
Speed Limit in our chat room has a follow-up on that about treating traumatic brain injury over the long term with cannabis. This seems to say, you know, the immediate effect is there, but how about long term?
Unfortunately, we don't even have the animal data on that, so I think it's still a wide open question. But obviously, if this is neuroprotective acutely, if you've got, you know, THC in your system at this time and that actually saves your life, certainly a little extra neuroprotection along the way of recovery would bound to be at best a great thing, and at worst no harm done.
Am I remembering correctly, there was a study that showed the heavy marijuana users through the 60s and 70s, now that they're getting into their later years, are showing less incidence of Alzheimer's?
It's still in that kind of tentative stage. We don't really have a big data set that suggests that's the case. And in fact, the folks who really have those data, it's a lot of times those Scandinavian big samples where there may still be some stigma attached to fessing up to use. So we're just going to have to wait and see.
All right.
Hey, Dr. Mitch, this is Kaliko. How you doing, my man?
Great.
Good. So I just had a quick question. I was running a medical marijuana dispensary for a little while, and we had some salve available that was actually made from CBD. So that they basically got it from our CBD heavy RSO that they infused into the salve. I was just curious, like cannabis infused or CBD infused salve, is that just a better route for a lot of people who are looking for any kind of muscle relaxation help with salves?
What's sad is we don't have any data on transdermal, meaning across the skin, transmission with CBD, except for these kind of weird things that kind of prick your skin, like a patch type thing.
Okay.
And so it's hard to really know. But if anybody's using them and seems to benefit, see if you can try the salve without the CBD and see if it's the same thing, or is it a placebo effect, or what's the story? But transdermal CBD is still kind of a mystery.
Sure, because I've always, like, people who've come in and used THC salves, I've always been kind of, hesitant to really, like, sell them on it, because I kind of feel like a lot of it's a placebo effect. But I was getting a lot of great reactions from CBD, so I was just curious if there was any literature on that. So I definitely know anecdotally that a lot of people are definitely finding a lot of relief from CBD salves, and I definitely think it's smart.
I mean, I've had a great massage with a cannabinoid-induced oil and was quite impressed myself. There are some anti-inflammatory effects transdermally for cannabidiol, but we've only got those data in mice.
All right, let's go to another question here about a study that came out over the past couple of weeks. This one, Amanda Ryman sent my way from Drug Policy Alliance, and it was a survey of Californians and their use of medical marijuana that seemingly dispels some of Kevin Sabet's talking points. Can you give us the lowdown on this study?
I mean, if it's the one I'm thinking of, the bottom line is basically 92% of all medical marijuana users say medical marijuana is the bomb.
Yeah.
And it really does address the symptoms that they are using it for. I shouldn't be fainting with surprise on this, but it's kind of reassuring to hear that, yes, in fact, I'm getting relief from the symptoms this medicine is for. And in truth, 92% is about as good as any pharmaceutical drug does. So I'm quite optimistic about that. No, it's not a randomized clinical trial where some folks get placebo and some folks don't, but I think this is the kind of evidence that, should inspire more of those kinds of studies so we can, point to this and say everything's fine.
All right. Something happening up here in the Great Pacific Northwest got some concern from a couple of my listeners who thought it was kind of creepy at best and big government, big brother at worst. And it was this plan in Spokane, Washington to test sewage to determine the THC levels and consumption in the city. How accurate can they test that as far as like location? Could they pick on like a particular neighborhood and maybe increase the DUI patrols there? And is this a scientific method that's used often to determine, a population's drug use?
What's funny is they've been doing this with pharmaceuticals now for at least the past 7 or 8 years to try to get a feel for just levels of opiate use, and it makes sense that this would get extended to this. Now, most folks' wastewater goes to a single wastewater treatment plant for the whole city, and in fact, often downstream it's then turned into drinking water, which isn't something any of us want to think too long about. But the potential to specify a particular neighborhood is still there. And I hate to sound like some paranoid stoner, but the bottom line is they could, in fact, narrow this down depending upon where they took the water source and increase patrols there if they were willing. So I understand people's apprehension about this. In truth, it's just one converging measure, too, because you can imagine, one person using a whole lot could taint the water for a whole neighborhood, and a couple of, very high-use sites could make an entire city look like they've got some kind of heavy use on THC. So it's really just a broad stroke kind of measure, and in truth, not the kind of thing that's going to address what we really need, which is, are there any cannabis-related problems? And, folks could use THC every single day and not have a problem as far as driving or their social life or their work or anything like that. And so I feel like in some ways this is kind of misplaced.
I would like to declare that Rolla J Studios has been doing its part to definitely raise the levels of the sewage treatment water for the Roseway neighborhood for 2 years now. We do what we can. A follow-up here on the Calico question regarding transdermal applications. And again, we know we don't have a lot of data on this, but have you heard anything about how the different formulations might vary as far as whether it's being formulated as an oil, as a cream, what types of oils they might use? Does that seem to make any difference?
Well, what's sad is that it's still really just in animal work. So they end up doing these transdermal applications that have a lot of what they call permeation enhancers. so there'll be like little prickly parts to it so that there's a chance for it to go across the skin more readily. And it's the kind of stuff that I just don't know if humans are really going to go for. But it is doing the kinds of things that we would hope. So that binge drinking, alcohol-induced neurodegeneration tends to dissipate if you've got this transdermal delivery of cannabidiol. And so I feel like the potential is definitely there. It may not be our standard use of, coconut oil and the best bud we can find. And we're just going to have to see how that works out.
Speed Limit in our chat room wants to note that wouldn't the city's THC sewage samples be skewed if someone were making ice water hash and dumping that water?
and God forbid you threw away all your trim or anything like that. That could completely wreck the whole measure.
Yeah. All right. One last question here. Just wondering if you could give us an update. We told the story of Dr. Sue Sisley, who got the first FDA-approved PTSD and cannabis study for veterans. Looks like she might be heading to University of Nevada, Las Vegas. What can you tell us?
It's a little early to tell, but the fact that they were willing to entertain her, to have her come and give her job talk, for her to explain her research, the federal funding in theory should still be available to her. She was the one who had the grant awarded, and I just love that there is a university willing to do this. She was super careful on this research. I really hope that she can, make it happen, but as you might imagine, basically the board of trustees at the University of Nevada, Las Vegas are probably sitting on this wondering just what all the implications might be.
All right. Well, we wish her the best of luck. And folks, if you didn't get a chance to get your question in, or you're just shy and want to keep it private, you can always send your questions to Dr. Mitch through 420research@gmail.com. That's 420research@gmail.com. Dr. Mitch, thank you so much for joining us. And we're looking forward to the next 4 weeks before elections of legalization in 3 states, medical in another state. What are you thinking?
I'm really optimistic. This New York Times endorsement today was definitely something that I think should help.
Yeah, big news for us. Well, thank you, Dr. Mitch. We'll talk to you next week, and good luck on everything.
Have a great one.
All right, when we come back, we've got my introductory speech at the MS Society of Oregon benefit. It was held last night at the Roseway Theater in Portland, Oregon, and I got to introduce